Hello everybody and welcome back to my channel, Heart and Soul. My name is Jessica and today I wanted to do a video on what schizophrenia entails and the signs and symptoms that describe the mental illness and its effects on the individuals diagnosed with this disease and what they go through every single day of their lives. But before I get into today's videos, please like this video if you liked it. Please share this wherever you can, and please subscribe if you haven't done so already. Now let's get into today's video. I apologize for the people who don't know the type of videos I do, but I do book reports because there's absolutely no way I'd ever remember this information without that. So I apologize if that's like annoying. And today I'm also in my living room, which I just left out, so that's why the background is different. I'm sorry if the lighting drives you nuts in the back or any of that stuff, but it's hot as hell upstairs, so I couldn't do it. So I just said, my mom took my daughter for a while. I said, I'm going to do this video, but in the living room. That's the only way, or I'll die up there. So thank God. So let me get into the video. So what exactly is schizophrenia? Schizophrenia is a long-term mental disorder of a type involving a breakdown in the relation between thought, emotion, and behavior, leading to faulty perception, inappropriate actions and feelings, withdrawal from reality and personal relationships into fantasy and delusion, and a sense of mental fragmentation. Its mentality or approach characterized by inconsistent or contradictory elements. It's a disorder that affects a person's ability to think, feel, and behave clearly. The exact cause of schizophrenia isn't known, but a combination of genetics, environment, and altered brain chemistry and structure play a major role. Schizoaffective disorder is a mental health condition including schizophrenia and mood disorder symptoms. Schizoaffective disorder is a combination of symptoms of schizophrenia and mood disorder, such as depression or bipolar disorder. Symptoms may occur at or the same time or at different times. These disorders require medical diagnosis. Cycles of severe symptoms are followed by periods of improvement. Symptoms may include delusion, hallucination, depressed episodes, and manic periods of high energy. Treatment for these disorders consists of therapy. People with this disorder generally do best with a combination of medications and counseling. The exact causes of schizophrenia are unknown, but research suggests a combination of factors can make a person more likely to develop the condition. Some people may be prone to schizophrenia, and a stressful or emotional life event can trigger a psychotic episode. There are 5 types of symptom characteristics of schizophrenia, which are delusions, hallucinations, disorganized speech, disorganized behavior, and the so-called negative symptoms. However, the symptoms of schizophrenia vary dramatically from person to person, both in pattern and severity. Number 1, delusion, is a belief or altered reality that is persistently held despite evidence or agreement to the contrary, generally in reference to a mental disorder. Individuals with persecutory delusions believe that they are being spied on, drugged, followed, slandered, cheated on, or somehow mistreated. An example might include someone who believes their boss is drugging the employees by adding a substance to the water cooler that makes people work harder. A delusion is a belief that is clearly false and that indicates an abnormality in the affected person's content of thought. The false belief is not accounted by the person's cultural or religious background or his or her level of intelligence. Number 2, hallucinations is a perception of having seen, heard, touched, tasted, or smelled something that wasn't actually there. Hallucinations can have causes that aren't due to underlying diseases. Example of this is drug intoxication. Common hallucinations can include feeling sensations in the body, such as a crawling feeling on the skin or the movement of internal organs, hearing sounds such as music, footsteps, windows or doors banging, hearing voices when no one has spoken, which is the most common type of hallucination. Number 3, disorganized speech, is characterized by a collection of speech abnormalities that can make a person's verbal communication difficult or impossible to comprehend. Diagnosed speech, or I apologize, disorganized speech is a symptom that frequently is associated with disorders of thought or perception, the inability to perform coherent or logical thoughts. Disorganized speech can take many forms, including repetition of words or phrases, nonsensical speech, the invention of new words, which is also called neologisms, the appearance of speaking with people who are not there, pressured or rushed speech, jumbled speech, word salad, or other forms of incoherent speech. Disorganized speech is one of the main symptoms of certain forms of schizophrenia. Although any condition that impairs thought can cause the symptoms, disorganized speech may be associated with other symptoms such as auditory or hearing or visual hallucinations, unusual behavior patterns, abnormal motor behavior, mood, and lack of ability to carry out daily functions. Number 4, disorganized behavior can manifest in a variety of ways. It can include odd, bizarre behavior such as smiling or laughing or talking to oneself or being preoccupied responding to internal stimuli. It can include purposeless, ambivalent behavior or movements. Purposeless meaning having no purpose, aimless or meaningless, and ambivalent meaning ambivalence and is a state of having stimulus, conflicting reactions, beliefs, or feelings towards some object. Stated another way, ambivalence is the experience of having an attitude towards someone or something that contains both positively and negatively balanced components. Number 5, negative symptoms include decreased thought and speech productivity or angolia, loss of ability to experience pleasure or adonia, a decreased ignition of goals, behavior, direct behavior or speech with little or no change to their tone, little or no change in their facial expressions. They may include the inability to show emotions, apathy, lack of interest, enthusiasm, or concern, difficulties talking and withdrawing from social situations and relationships. There is also a third group of symptoms, usually called cognitive symptoms. Cognitive impairment may accompany symptoms related to other problems such as injury, stroke, or dementia. These symptoms may include change in sleep patterns, change in mood, personality, or behavior, confusion or loss of consciousness, or even a brief moment. Schizophrenia affects men and women equally. It occurs at similar rates in all ethnic groups around the world. Symptoms such as hallucinations and delusions usually start between the age of 16 to 30. Men tend to experience symptoms earlier than women. Schizophrenia is predominantly a young condition. In fact, about 70% of cases start in people aged between 16 to 25. It strikes most commonly in late teens and early 20s, which is often a time when the individual is going through considerable emotional and psychological changes as a normal part of their development. There are probably some questions that you may have surrounding schizophrenia. So I decided to do a question and answer for you. Is schizophrenia hereditary? Schizophrenia tends to run in families, but no single gene is thought to be responsible. It is more likely that different combinations of genes make people more vulnerable to the condition. However, having these genes does not necessarily mean you'll develop schizophrenia. Number 2, what are your chances of getting schizophrenia genetically? Your chances are highest 50% if you have identical twin with the disorder, but some people with schizophrenia have no history of it in their family. Scientists think that in these cases, a gene may have changed and made the condition more likely. Myths surrounding schizophrenia and the misperception and differentiating between what schizophrenia is and isn't. Number 1, schizophrenia isn't a brain disorder. False. Schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. Number 2, schizophrenia involves a split personality. Fact. Schizophrenia is a separate, related condition to dissociative identity disorder, which involves split personality. Number 3, people with schizophrenia are dangerous. Fact. The fact is, people with schizophrenia are wrongly identified as being dangerous through their portrayal in popular media. When individuals are diagnosed with schizophrenia alone and not a co-occurring condition, They are unlikely to be violent or dangerous according to the APA or American Psychiatric Association. In many cases, individuals with schizophrenia live in special homes with their families or on their own. If they are high functioning, people with this condition may still exhibit unpredictable behavior. Number 4, individuals with schizophrenia can't hold down a job. With proper treatment, schizophrenic individuals can be high functioning and successfully manage their condition. If they are diagnosed with schizophrenia, you may qualify for Social Security benefits. Unfortunately, most people with schizophrenia are unemployed. For those that are successfully managing their condition, some of the best types of jobs for schizophrenics include careers that give people meaning and structure, that decrease or alleviate hallucinations or delusions. Sorry, I have another book. Where an individual feels comfortable and supported with tasks that will not overwhelm or cause excessive stress to that individual, with flexibility, either part-time or full-time hours. Number 5, the myth number 5. Schizophrenia is caused by bad parenting. Schizophrenia has specific genetic and environmental risk factors and is not directly caused by bad parenting. This stereotype cannot be further from the truth. Schizophrenia has numerous genetic causes. Each of these has a small impact on the overall development of the condition. Some risk factors for developing schizophrenia include experiencing severe childhood stress or trauma, or infections that stimulate the immune system. Another genetic risk factor includes a small deletion in chromosome 22. Chromosomes are responsible for storing all of our patterned genetic information. A small deletion in chromosome 22 can predispose an individual to develop not only schizophrenia, but heart, immune system, and developmental problems, for example, a cleft palate. Myth number 6, schizophrenia requires long-term hospitalization. In many cases, individuals with schizophrenia can be successfully rehabilitated back into society. Not all individuals with schizophrenia require long-term hospitalization. Some may be hospitalized if they exhibit schizophrenic symptoms for the first time or if they continue to experience schizophrenic symptoms after treatment and medication. Some typical schizophrenic treatments include therapeutic methods that block dopamine receptors in the brain, behavioral and psychotherapy with the overall goal to address cognitive impairments and improve memory, improving psychosocial interactions, for example, workplace rehabilitation. Depending on how an individual responds to treatment will indicate how long-term their treatments are. Schizophrenic symptoms require long-term treatment, though long-term hospitalization may not be necessary unless symptoms are severe. Myth number 7, schizophrenia symptoms are the same for everyone. Not everyone with schizophrenia experiences the same symptoms, nor the same severity of symptoms. There are several different types of schizophrenia, including paranoid, disorganized childhood, and catatonic schizophrenia. Other conditions that are closely associated with schizophrenia include schizoaffective disorder, agoraphobia, and panic disorder. Agoraphobia is a condition that comes with extreme or irrational fear of entering open or crowded places, or leaving one's own home, or being in places from which escape feels difficult. Schizophrenic symptoms and types vary depending on the culture in which the individual was diagnosed. For example, delusions of a religious nature are more common with Christianity, where Christianity is practiced, whereas it is not the case in societies that practice Hinduism. Buddhism and Muslim religions are more commonly practiced. Individuals living in Africa are more prone to hallucinations relative to other societies. A correlation was found between a worse prognosis in societies with higher linguistic aptitude. Linguistic aptitude sees it as an individual's initial state of readiness and capacity for learning a foreign language and probable facility in doing so given the presence of motivation and opportunity. Interestingly, these results suggest that schizophrenia symptoms range in severity across different cultures. Myth number 8, schizophrenia impacts intelligence. Schizophrenia does not have an impact on a person's intelligence at all. It is often associated with a higher intelligence. A study conducted in 2014 showed that there was no association between genius or high intelligence and the development of schizophrenia. Another study found that people who develop schizophrenia have lower IQ tests before and after the onset of schizophrenia. There have been reports of individuals with very high IQs that have schizophrenia. Nevertheless, these individuals make up a very small proportion of cases. Myth number 9, schizophrenia causes sudden mood swings. Fact is, schizophrenia is related to both bipolar disorder and schizoaffective disorder, which are characterized by sudden and alternating mood swings. However, schizophrenia is an entirely separate condition. Bipolar disorder is defined as a condition whereby a person cannot regulate their moods. Mood swings range from low to depressive to manic. Myth number 10, schizophrenia cannot be treated. Fact is, schizophrenia can be treated with several evidence-based treatments. Currently, there are several focuses on the treatment for schizophrenia, along with antipsychotic meds that target the brain's dopamine receptors, pharmacological agents which include target glutamate, glycine, and acetylcholine receptors. Glutamate is a chemical compound in neuroscience. Glutamate refers to an anon of glutamatic, oh my God, that's so terrible, acid in its role as a neurotransmitter, a chemical that nerve cells use to send signals to other cells. It is by a wide margin the most abundant excitatory neurotransmitter in the vertebrate nervous system. Glycine is one of the proteogenic amino acids. It is used for treating schizophrenia, stroke, and some rare inherited metabolic disorders. It is also used to protect kidneys from the harmful side effects of certain drugs used after organ transplants, as well as liver from harmful effects of alcohol. These are terrible. I am so terrible at pronouncing these, and I am so terribly sorry. Acetylcholine is an organic chemical that functions in the brain and body of many types of animals and is a neurotransmitter. A chemical message released by nerve cells to send signals to other cells such as neurons, muscle cells, and gland cells. It is the chief neurotransmitter of the parasympathetic nervous system, the part of the autonomic nervous system, this is terrible, that contracts smooth muscles, dilates blood vessels, increases bodily secretions, and slows down your heart rate. Because this plays an important role in muscles, actions, drugs that influence the neurotransmitter can cause various degrees of movement disruption and even paralysis. For example, the brain might send out a signal to move your right arm, but it doesn't move. Nearly 2 million American people suffer from schizophrenia today. To be diagnosed with schizophrenia, a patient must have a psychotic or loss of reality symptoms for at least 6 months and show increasing difficulty in functioning normally. The treatment success rate for schizophrenia is 60% compared with 41 to 52% of heart patients. Because people with schizophrenia must take their meds for many years, usually for their entire life, many may experience varying side effects. Since psych meds are used to help treat the symptoms of schizophrenia, some people may experience side effects that are inconvenient and unpleasant, but not serious. The most common side effect from psych meds are dry mouth, constipation, blurred vision, and drowsiness. Less common side effects are decreased sexual desire, menstrual changes, stiff muscles on one side of the face or jaw, More serious side effects are restlessness, muscle stiffness, slurred speech, tremors of the hands and feet, and a deficiency of a type of white blood cell when taking clonazepam. I apologize, which requires close monitoring while taking this drug and other psych meds. Tardive dyskinesia is the most unpleasant and serious side effect of antipsychotic drugs. It causes involuntary facial movements and sometimes jerking or twisting movements of other parts of the body. This condition usually develops in older patients, affecting 15 to 20% of those who have taken antipsychotic drugs for years. Despite media focus on the exceptions, individuals receiving treatment for schizophrenia are no more prone to violence than the general public is. Unfortunately, almost 1/3 of all U.S. jails incarcerate people with severe mental illness who have no charges against them, but are merely awaiting for psychiatric evaluation or the availability of a psychiatric hospital bed. Some other facts about schizophrenia are about 1 in every 100 people develop schizophrenia at some time during their lives. Schizophrenia is one of the most common mental illnesses. More hospital beds are occupied by persons with this diagnosis than any other psychiatric disorder. This illness is found all over the world. People with schizophrenia often die at a considerably younger age than the rest of the population. The reasons for this include late diagnosis and poor treatment of physical illness, metabolic side effects from antipsychotic medications, unhealthy lifestyle, and high risks of suicide in this community affected by schizophrenia. There are several types of therapies that you can be involved in to better help manage your signs and symptoms of schizophrenia. They include individual therapy, CBT or cognitive behavioral therapy, cognitive enhancement therapy or CET. CBT or cognitive behavioral therapy, this can help an individual change their thinking and behavior. A therapist will show them ways to deal with their voices and hallucinations. With a combination of CBT sessions and medication, they can eventually tell what triggers their episodes, times when hallucinations or delusions flare up, or how to reduce or stop them. CBT is a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and several mental illnesses. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. CBT has been demonstrated to be as effective as or more effective than other forms of psychological therapy or psychiatric medications. CBT is based on several core principles. Treatment usually involves effort to change thinking patterns. The strategies may include learning to recognize one's distortions in thinking that are creating problems and then to reevaluate them in light of reality. Gaining a better understanding of the behavior and motivation of others, using problem-solving skills to cope with difficult situations, learning to develop a greater sense of confidence in one's own abilities. CBT treatment also usually involves efforts to change behavioral patterns. These strategies may include facing one's fears instead of avoiding them, using role-playing to prepare for potentially problematic interactions with others, learning to calm one's mind and to relax one's body. CBT, the client and therapist work together to develop an understanding of the problem and then develop a treatment strategy to that individual's specific needs. CBT places an emphasis on helping individuals learn to be their own therapists. CBT therapists emphasize what is going on in the person's current life rather than what has led up to their difficulties. A certain amount of information about the client's personal history is needed, but the focus is primarily on moving forward and to developing more effective ways to coping with one's life. Individual psychotherapy is another form of therapy used in the ongoing treatment of schizophrenia. In individual therapy, also known as individual psychotherapy or individual counseling, the client and therapist meet one-on-one once a week for 45 minutes to an hour. The sessions are conducted in a confidential, caring environment. They will work together and explore their feelings, work through life's challenges, and identify aspects of them and their lives that they wish to change and set goals to help them work towards these changes. The client may only see a therapist for only a few sessions, or the individual may need to attend for a year or even longer. The amount of time spent in therapy really just depends on the individual's needs as well as their personal goals. Cognitive Enhancement Therapy, or CET, is a recovery phase cognitive rehabilitation training program for adults with schizophrenia or schizoaffective disorder. CET is for those who are symptomatically stable yet continue to lack social and vocational abilities. CET is designed to provide cognitive training to help participants improve neurocognition, including poor memory and problem-solving abilities, cognitive style, including unmotivated, disorganized, or inflexible cognitive styles, social cognition, which is including lack of perception, taking foresight, and social context to praise, social adjustment, including social, vocational, and family functioning, action-based cognitive remediation, or ABCR, was developed as a form of cognitive remediation that aimed to optimize the transfer of cognitive gains to improvements in quality of life and reductions in disability. The program has several techniques that stand apart from other cognitive remediation treatments, including an emphasis on collaborative goal setting, increased confidence in how one uses his or her cognitive skills and strategies, and planning for a lifestyle that reduces avoidance of cognitively challenging situations. ABCR combines the traditional cognitive training techniques with stimulated workplace situations. Each ABCR session includes an educational section, drill and practice, computer exercise designed to facilitate the development of strategies to overcome cognitive challenges, and group-based role plays for applying those strategies. ABCR offers client appropriativity challenging activities to build their cognitive muscles. ABCR is appropriate for adults with schizophrenia spectrum disorder who might benefit from improvements in community functioning, everyday functioning, lower job stress, increased employment, and increase in cognitive abilities. Another form of treatment for schizophrenia is antipsychotic medications, which are most commonly prescribed drugs. They are thought to control symptoms by affecting the brain's neurotransmitter dopamine. The goal of treatment with antipsychotic medications is to effectively manage signs and symptoms at the lowest possible dose. The psychiatrist may try different drugs, different doses, and drug combinations over time to achieve the desired result for the individual. Other medications may also help, such as antidepressants, SSRIs, and anti-anxiety drugs. It can take several weeks to notice any improvement in symptoms when initially starting these medications. Because medications for schizophrenia can cause serious side effects, people with schizophrenia may be reluctant to take them. The willingness to cooperate with treatment may also affect the drug choice. For example, someone who is resistant to taking medication consistently may need to be given an injection instead of taking a pill. Second-generation antipsychotics. These newer second-generation medications are generally preferred because they pose a lower risk of serious side effects than do the first-generation antipsychotics. An example of a drug with drug would be Abilify or Aperazole. First-generation antipsychotic medications have frequent and potentially significant neurological side effects, including the possibility of developing a movement disorder, tardive dyskinesia, that may or may not be reversible. These antipsychotics are often cheaper than the second-generation antipsychotics, especially the generic versions, which can be an important consideration when long-term treatment is necessary. There are also long-acting injectable antipsychotics. Some antipsychotics may be given as an intramuscular, which means in the muscle, or as a subcutaneous injection, which means injected into the layer between the skin and the muscle. It means just under the skin. Subcutaneous injections are highly effective in administering medications, for example, such as insulin or morphine. So maybe you are wondering, what do people with schizophrenia see? Roughly 70% of people with schizophrenia will experience hallucinations. Auditory hallucinations are most commonly experienced by people with schizophrenia and may include hearing voices, sometimes multiple voices, and other sounds like whispering or murmuring. Aggressive behavior and impulsivity are often found in paranoid schizophrenia and can occur during both acute and chronic phases of the illness. Impulsivity, reflection, and it seems to be related to the failure of behavioral filtering outside of consciousness. Patients with schizophrenia may show dysfunctional impulsivity and impulsive aggression. Although this neurological aspect of aggression in patients with schizophrenia are still not well understood, impulsivity and aggression may correlate with frontal and temporal brain abnormalities. Psychotic symptoms, such as delusion and hallucination, are subsequent suspiciousness and hostility may result in aggressive behavior, or aggression may be impulsive and caused by an environmental frustrating event. Patients may be more aggressive and violent during acute episodes. Schizophrenic patients have less insight, experience greater thought disorder, and have poorer control of their aggression impulses. Comorbidity with alcohol and other substances of abuse is frequent and complicates the agitation and impulsivity. That's really what I had for schizophrenia, but I just wanted to, I don't know, talk about it because I do have some people in my family, very close family, people that I love very much, are affected by schizophrenia, and my phone's going off, sorry about that. And I just wanted people to be more clear about what that was. I know maybe you might not know much, or you have a whole different perception of what people with schizophrenia are really like, but the people I've had in my life for my whole life, and they are the best people I know. So kind, so sweet. Never seen aggression. I've never seen an aggressive bone in their body, and I really hope that, the misconception is a little less when you know a little more about something. So I cannot believe that my phone has not shut off yet, so I'm super happy about that. But I do apologize for the not being able to pronounce the words. I got them out there, but I apologize about that. They're like this long, you know what I mean? So but I wanted to do this video today and put it out there. But I also was just thinking the other day that I kind of wanted to do something so you could see like what my life was like, what autism is like in my family. But I was watching some other channels, and a lot of them have their, children on there or their loved one on there. And me personally, I just can't do that because I just feel like there's too many sickos and weirdos out there, and too much room for criticism, and she already has enough of that. So I just wanted to see like maybe if there was like something that would maybe draw people in to this channel. I'm gonna have to learn how to network better because I am just terrible at it. So if you guys can help me, I would really appreciate it. Just maybe some ideas of what you would like to see, or what would, maybe boost this channel. But I apologize for switching topics. And I apologize for all the little annoying things that I do. I just hope that you can get past those to watch this video because it's super important. And, if you have anyone or you are affected by schizophrenia, it's fine. You're just like everybody else. And I look at everybody the same, and I really hope more people start to do that. And so I just want to thank you for watching this video. I know it was super long, but I feel like I had a lot to say, and I hope you are safe, and I hope that you tune in to my next video. And if you have not subscribed already, please do so. If you like this video, please like it. Please share it out because it's super important for people to know about. Please give me any comments or suggestions of what I can do better. I know pronouncing the words is probably one of them, so I'm expecting that. But thank you so much for watching. To my subscribers, thank you for subscribing and returning and watching my videos. Even if you haven't subscribed and you keep watching my videos, thank you so very much. I really do appreciate it, all the comments and interaction. That means a lot to me. So thank you so much, and I will be back with another video. My daughter's graduating from school next week, so it might be like a little bit few and far between, but I'm hoping not. I'm trying to put out at least one video a week. So until next time, thank you so much, and I'll see you soon. Probably still be in the living room because it's still going to be hot as hell. Bye. Have a good one.